Hello and welcome to Real Health. Thank you so much for tuning in to the show. Today we're talking about how to get the most out of your chosen medical aid plan. It's not just about having your plan and paying your premiums every month. It's about understanding your benefits, using preventative care, and making smart health choices. So joining us to unpack all of this once again is Lee Callacoppan, the Principal Officer at Bonitas Medical Fund. Now Lee, I think we've spoken before about choosing the plan and understanding that part, but in terms of having it, utilizing it to your benefit so that you know you're getting the most out of it, value for money, what are the most important considerations that people need to be thinking of?
Michael, thanks once again for having me. In considering how to make the best out of your medical aid plan is starting with where we had our last discussion. It's about healthcare screening. It's being able to understand specifically what is my healthcare needs, what's my baseline, and where do I need to seek and have access to the necessary healthcare to ensure that I prevent the onset of disease later in my life.
Right.
That's the starting point. The second component is understand specifically, if you've chosen an option that you require to utilize a network of professionals, understand who your elected GP is, which is the primary gatekeeper of healthcare.
Right.
We would advocate. Understand that if I need to go to a hospital, which is the hospital that I need to access my emergency services from, or if I need to get my chronic medication for a specific pharmacy, we call it a designated service provider, that you understand all of it.
Okay.
Why is that important? Because it can prevent a lot of out-of-pocket expenses
Right.
for you.
Okay.
And that is normally where members become very disgruntled. You know, my medical aid didn't cover it, or there was a co-payment, or there was a levy. By following those, what we call care pathways, and accessing your healthcare, you can prevent those disappointing aspects around it. Also, a key aspect, and you know, that we have seen over the years, is that people, especially when they go for a pre-approved procedure, is to understand what is the quote, what is going to be covered, and what type of auxiliary services goes with that procedure. People take it as a given that, you know, when the dietitian comes into the ward, that it's going to be covered, or the physio. The question is those additional services actually prescribed and required as part of your fuller procedure?
Right.
Because otherwise you get surprises afterwards and the medical aid says, oh, we didn't authorize this.
Yes.
Just ask the question.
Okay.
What is covered? What is the quote associated with it? And did you get an authorization to do it?
Okay. Now, I think that's a key element, ask the question, because I suppose with these schemes, there's a lot of complexity to it. And it's not something that many people are going to sit at the beginning of it and read every element, which would probably be the responsible thing to do, but it's not always practical. So can we just confirm that? So any procedure that you're going to have or undergo, obviously if you know ahead of time, to be clear, ask the question, understand so that you have no surprises.
100%. We term it elective procedures, and traditionally, and healthcare providers as well as hospitals appreciate and understand, will guide the member and say, please ensure that we get an authorization, or can you obtain an authorization? Some practices obtain it on behalf of members as part of being patient-centric. But once it's received, ask, can I have the detailed breakdown to understand what is going to be the member's portion, if any, or is it covered? And look, it's not a exact science. Sometimes there is complications associated with it, but the healthcare provider and the administrative staff would normally engage with a medical scheme to ensure that those things are covered and considered.
Now, what about things like prescribed minimum benefits, chronic medications, things that in my personal experience, certain doctors haven't been so forthcoming by saying, oh, for this one, apply for prescribed medical benefits or chronic medication or whatever the case may be. How do we make sure that we get the best of those elements as well?
This is really where the industry has come a long way, specifically medical schemes. From a Bonitas perspective, we stepped away years ago from what we call sick care to proactive preventative care, partnering with our members. So key for us in relation to it is that as we get through either screening information to say to and contact that member proactively and say, you need to go onto a care program. We have noticed that there is what we call emerging risk factors, and we share that detail with them. That also happens when doctors, through just annual screenings identify and say, here's early onset of diabetes, they will contact the medical scheme, and we will engage in terms of with them as well as with the member in terms of being able to guide them and understand. And when even claims are received by us, Michael, key for us and doctors through coding is able to say this is a prescribed minimum benefit and it must be paid out of risk, even though there might not be savings associated with it. And under the regulatory environment, we compelled as a medical scheme to consider and act and treat the patient fairly.
Okay. Now, if people have queries, so perhaps they're considering something, they need the information, they haven't got it at hand, their care provider is not able to provide them with the exact information. How easy is it to engage with a medical aid directly, or do you need to go to your financial consultant for that? What's the best way to approach it in that way?
Michael, I think as society and living in the information age, it has become so much easier for the consumer and specifically members to obtain the information. So the traditional structures through a call center still exist, but through our mobile apps, our websites, our AI tools, we've introduced Dr. B. You can engage with Dr. B, and he'll be able to feed you answers immediately. In the event that you need to speak to an individual, contact centers, websites, and query helplines is all available for members.
Wonderful. Now, Lee, another point that's become huge with medical aid schemes is benefit programs. So not only utilizing the actual benefits that are part of your medical aid scheme, but additional things that you can do to preempt or to reduce the risk of, like lifestyle things, and also gain other additional benefits into your profile. How have these changed the game in terms of medical aid?
Michael, you're referring to the care programs. So we've got, and medical schemes from a Bonitas perspective, we've got multiple care programs. It started really, in the early 90s with the development and the onset of HIV. And HIV is a disease program, and we term it under a care program, where there's a coordination of care between multiple service providers in actually coaching, helping guide the member how to best manage their disease. This has evolved into care programs such as diabetes, back and neck, female health programs, to be able to proactively empower, coach, and guide and direct the member on the appropriate care pathway to get the best quality of care. So this links to access, quality of care, as well as affordability to ensure that the member gets value for money.
Okay. And then I suppose the final element would be rewards programs in terms of additional gains for the members. How do those work?
Yeah, so, as Bonitas, we stuck to focusing on value-added programs that is within the business of a medical scheme, and where we can add actual real value back. I know within the industry there's multiple what they call value-added or rewards program. We have stuck in terms of what is the type of value add that we can give back to our members. So very proud to say that I believe we were a market leader in terms of our benefit booster, where we actually through behavioral science try to encourage and change members' lifestyle and behaviors, but encouraging them through to actually getting to be empowered around the data that exists through health screenings. So we encourage them to do health screenings, understanding their health data, providing that through to the medical scheme, and being able to then link them to the relevant programs. And just by doing that, we unlock additional benefits. It doesn't come from your savings, it's paid from risk, and the member is free to utilize that for anything that can contribute towards their healthcare activity. So whether it is seeing a dietitian or doing a hearing screening, it's for their value, and that is unlocked either at a member level or at a family level annually. Final comments from you in terms of encouraging people to engage more deeply with their medical aids and really understand what their benefits are. So my parting words would be, healthcare doesn't have to just be about sick care. You can live well, but choosing your medical aid partner is essential. It starts, yes, with understanding the cost factor, but look at the underlying value that can be unlocked.
Absolutely.
Whether it's through the managed care activities, whether it is being able to ensure that the scheme is sustainable in terms of paying their claims into the future, but take a proactive step every single or annually in understanding which option are you on, what benefits exist for you, and engage. Make it a habit to understand and value your health through your medical scheme.
Excellent. Lee, thank you so much. I think these discussions through the series have been really valuable to me personally in terms of understanding how you can really take advantage of your medical aid rather than it just being, I think for some people, a bit of a grudge purchase. So it's quite liberating. So thank you for that.
Thank you very much.
It's a great pleasure. After the break,